What is a GIST biopsy? Understanding stomach cancer diagnosis. Imagine trying to figure out what kind of tumor is growing in your stomach. That's where a GIST biopsy comes in. It is a procedure used to collect a small piece of tissue from a tumor called a gastrointestinal stromal tumor, or GIST. These tumors can develop in the stomach or other parts of the digestive system. Since imaging scans alone cannot tell us if a tumor is a GIST, doctors need to examine the tissue under a microscope to make a clear diagnosis. This step is crucial because it helps determine the best treatment plan and understand the nature of the tumor. The most common way to perform a GIST biopsy is called endoscopic ultrasound guided fine needle aspiration. In this procedure, a doctor uses a special instrument called an endoscope, which is a thin, flexible tube with a camera and an ultrasound probe attached. The endoscope is gently passed through the mouth into the stomach. The ultrasound helps the doctor locate the tumor precisely. Then, a very thin hollow needle attached to the endoscope is used to carefully draw out small tissue samples from the tumor. This method is minimally invasive, meaning it causes less discomfort and has a lower risk compared to surgical biopsies. It allows for accurate targeting of the tumor, making it easier to get the right tissue sample without needing open surgery. After the tissue is collected, it is sent to a laboratory where pathologists analyze it. They look at the cells under a microscope to see if they are cancerous and perform special tests called immunohistochemistry. These tests detect specific proteins like KIT, also known as CD117, and DOG1, which are markers commonly found in GIST cells. Sometimes, molecular genetic testing is done to identify mutations in genes like KIT or PDG-FRA. These mutations can influence how the tumor behaves and what treatments might work best. The pathologists also assess how quickly the tumor cells are dividing, known as the mitotic rate, which helps in staging the cancer and planning treatment. In some cases, the biopsy may not provide enough tissue, or the results may be inconclusive. When that happens, a more invasive surgical biopsy might be needed to obtain a larger sample for a definitive diagnosis. Overall, a GIST biopsy is a vital step in understanding whether a stomach tumor is a GIST and in guiding the next steps for treatment. It is a safe, minimally invasive procedure that provides essential information for managing stomach tumors accurately and effectively. If you or someone you know is facing this situation, always consult with healthcare professionals for personalized advice and care.